All right, thank you. My name is Richard Swift. I'm the Director of Health, Housing, and Human Services for the county. It is my pleasure to present our FY19 budget to you today. So this is our first time doing Performance Clackamas, and I've been instructed to keep this short, and so I will endeavor to do so. So our first slide here is about our mission, and this came from our work with Performance Clackamas, and in many ways represents one of the best conversations I've had with my department leadership regarding how we do our work, why we do our work, and how to describe what we do. And so the mission of H3S is to remove barriers for vulnerable individuals and families on their path to improved health, wellness, prosperity, and inclusion. And so what I want to do is take a moment and what I want to do is have folks, starting with Chuck, actually introduce themselves as their, so Chuck is...
Hi, I'm Chuck Robbins. I'm the Director of Housing and Community Development, and that's the Housing Authority.
And Chuck, how long have you been working here?
Going on 40 years.
Wow.
In community development.
Thank you,
You
Chuck.
got stuck with me for a long time.
Started with
We
the
rather
county when he
like
was
it.
16.
Thank you.
We're to the next 40.
Yep.
Yeah.
I'm Jill Smith. I'm the Deputy Director of Health, Housing, and Human Services. I work very closely with Rich.
Good. And if I may just remind you also that we're being taped and televised, so the using the microphone would be really
Oh,
important.
they should step forward then?
Yeah.
Okay.
So there's a
All right.
couple of them up there and kind of get in queue. Yeah.
Good afternoon. My name is Brenda Durbin. I'm the Director of the Social Services Division. We operate programs to help low-income individuals, older adults, people with developmental disabilities, and veterans. We also have a large volunteer program.
Thank you.
So I am Deborah Cockrell. I'm the director of the health centers, and we serve, we're safety net clinic for the county, federally qualified health center. We do primary care, dental care, and behavioral health services, as well as school-based.
Good afternoon, Mary Rumbaugh, Director of Behavioral Health Division. We are responsible for about 62,000 covered lives here in Clackamas County who are on the Oregon Health Plan. We provide their mental health and addiction benefit. We are also responsible for the safety net, so we have 24/7 crisis response via phone and mobile, as well as an urgent mental health walk-in clinic.
Very good. Thank you.
Hi, I'm Dawn Emmerich. I'm the Director of Public Health. We're responsible for environmental health, which is our restaurant, childcare, hotel inspection, regulatory work. Population health management, which is all of our air quality, water quality, opioid work, as well as chronic diseases. We also do access to care, which is really about assurance. We don't do any of the direct service. That is what our health centers do, but we are sure folks have access to services. And we also do the birth certificates and death certificates and infectious disease control and prevention.
Very good. Thank you.
Hello, my name is Rodney Cook. I've been Director of Children, Youth, and Families Division for about 22 years. And recently, you'll see in our budget that we just merged with Community Solutions. So you've been used to Maureen Thompson coming, so it'll be me this year. We do weatherization. That's for low-income families. We make sure that their energy assistance that they need, energy efficiencies in their home are provided. We do workforce, and that's basically one of our key pieces are with people coming out of the justice system who need assistance there. And we have the VETS program, and the vets typically have PTSD or brain injury. So there's high barrier populations are what we really specialize in for the county and on behalf of the county. Children, youth, and families, we do pretty much anything under the prevention world. So that could be domestic violence, that could be drug and alcohol, that could be school dropout. And we do early childhood, so that's really getting parents ready to get their kids ready for kindergarten. So it's kind of a whole gamut of prevention and early intervention work we do in that regard. So that's our division. Thank you.
Good. Thank you.
Thank you, Rodney. So this team I appreciate intensely. As you know, I guess Chuck's a bit of a ringer in terms of years of public service, but you have well over 100 years of public service across this team, and that's why our conversation, because you had so much institutional knowledge about how services have occurred and what the needs are in the county regarding our mission. That's why that conversation was such a good one, because as Deborah talked about, we are the safety net in many ways. We're not the complete safety net, but we are part of that safety net for the county, where we're focused on the most vulnerable families and individuals. And and this work is really about taking policy, doing the research around the policy, looking at best practices nationally, and then combining that with advocacy, because policy without that advocacy, without operational implementation, is essentially a nice white paper on an issue that's affecting everyone that actually does nothing to improve the life of the residents. And so that's really what drives the mission of this organization, and it's one that focuses on looking at, in terms of that barrier removal, how do the people receiving our services look at those pathways for services, and how do they view barriers? It's not about us identifying barriers. It's about listening to the folks we receive services from, and then going in and taking the barriers that they perceive to be in their way towards their prosperity and their wellness. So the next slide, and you'll see, well, actually, back up, Chuck, if you could. So there, and that was one of the purposes of also introducing the division directors, is you see the breadth and the wealth of H3S in terms of our department structure. One of the biggest in the county, and certainly a broad scope of work in front of you. The next slide, please. So this is essentially just a discussion of what you see in front of you regarding our general fund and our overall budget. So across the 3-year trend, starting from FY17, the overall budget in terms of revenues was a little over 122 million, 120, yeah. And, of that, in terms of actuals expenditures, a little under 100. And then we've been climbing steadily. We're, I think, a little level right now, and I think a driver on that ultimately for FY19 is the current administration. They've flattened out a lot of our revenue from the Fed, and also going to the state, because the bulk of our revenue is federal, state, and then also in a later slide you'll see actually a fair amount of charges for services rendered. And so at this point, we're flat. I don't know what we can talk a little bit later about. In terms of dollars, we do have some issues in public health. I'll talk about that. But I think we're actually pretty healthy. Deb and her work with the health centers has built up a really nice fund balance in terms of their operations, and has I think, an outstanding cushion. So overall, in terms of the county's general fund as it relates to our budget, it's just under 7%. And the dollars that we take from the general fund are essentially the county's commitment towards the services that we are offering to the residents. We often need these dollars in terms of services as match. Some of our funding sources require a match from the county in order to be able to apply. And so we leverage the county's general fund towards those matches. So I think when you really look at the county's general fund against the overall budget of the department, the county's being pretty successful at leveraging services to the residents of the county. I'm certainly going to never say no to more general fund.
Just saying, huh?
Yeah, exactly. Just saying. I got I think some good examples here of, how the general fund has been used to help the residents, and these two services, these two stories come from Bridges to Housing out of social services. The first is about a disabled mom, 2 kids on the autism spectrum. We discovered them, began working with them when they were sleeping in the car, doing some periods of couch surfing. And so we began working with the family. Through that work, we were able to eventually get them into housing. One of the things that the housing does is immediately stabilize the family.
Yeah.
So then we can begin looking at what type of medical services do they need, how do we render services to kids who are autistic. Eventually got both children on SSI, so that brings more financial stability into the family. Began working with the mom, discovered that she too was also on the autism spectrum, so began bringing directed services to her and ultimately stabilizing the family after 2 years in housing. And they're actually headed towards being somewhat independent on their own. They'll still, I think, stay connected with us and with partners like NAMI in terms of services to the family. Another example is a vet, 54-year-old vet, who we first met. It was actually Dave Denny who began working with him. Houseless for 20 years and living on a bridge. A lot of people are like, well, why doesn't someone who's a vet who's been outside for 20 years do something about that? Well, one of the reasons is folks develop, a connection. And so he had an extremely strong family, not his family of origin, but a family that he had developed through living on the streets. And finally, he, in working with Dave, came to at 54, my age, decided that maybe living outdoors was a little too hard. And the last winter, we had a decent winter this year, so to speak, in terms of how cold it was. But the previous winter, he finally was like, I can't do this anymore. So we've been working with him. He has now been housed and building a successful relationship with him. And these are actually two stories that come directly out of our general fund use from the county. So for that, we are certainly grateful. Any questions in terms of general
No,
fund?
and
Okay.
we'll actually wait until you
okay,
finish your
great,
presentation,
fantastic.
and then we'll have a call for
And-
questions.
And one of the things I want to also emphasize with this particular story is that because there's often with houselessness an assumption, I think, society that either there's a behavioral health issue. It's either substance abuse or it's mental health or it's both. And in this individual's case, it really wasn't either one of those, which is unusual. But it was about the fact that he had a family who he was very, very, very strongly connected to, who he had identified with and was absolutely reluctant to, who he felt a high sense of responsibility for. So it was actually, and I think it was Dave who helped him make that transition to moving to and away from houselessness. So our proposed budget here, as you can see in that last slide, where it's really not that much different from last year's. So as I said, we got 29% coming from the state. Local is 2%, charges for our services 28%, other funds 1%, interfund transfer, which is largely our general fund, at 7%. Fund balance and prior year revenue, 21%. Licensing and permitting, which we actually don't do a ton. Most of that sits within public health at 1%, and then in our federal at 11%. And then the bulk of our material services and expenses, essentially personnel services, and then material and services. So I think we can go to the next slide. So in terms of FTE, again, we are essentially flat, 0.9 increases, essentially flat. And so last year, FY18, we were at 530. This year we'll be at 535. Now that, if you count people working in the department, because we have a fair amount of temps and also part-time, I think our actual people count is probably just a touch over 600, I think. So, and that's how I tend to think of the department. But this is the financial expression of what we do in terms of our work, but in terms of the people expression of what we do, I think we're north of 600. And then if you count our volunteers that also do a fair amount of work with our population, we're well north of 600. So moving on from that slide, so this next is just a proposed budget by division. So our health centers are our largest at 36%. Our smallest is my office at 1%. My office has an extremely good return for the money put into it. And then
Editorializing here?
what?
No editorializing?
No, just facts. Just facts. And so then we have housing, community development. I'll just go around the left here. At 5% of the budget, public health 7, social services at 22, behavioral health at 22, and children, youth, families, and community solutions. And I've been on Rod about actually a new name for his division at 7%. So we can, and then we got a few results coming out of for you here in terms of performance Clackamas. I got a few more stories tied to these. This is actually when we were first doing this, we were looking at performance Clackamas and what we were going to present, and I was told we were going to be really, really short this year. I thought, well, if I'm going to go through every single one of our measures related to performance Clackamas, I will not be doing a short budget presentation. So this is actually just a small number of the total performance measures that we're using in the department. And actually, the performance Clackamas work for us was not, it was actually, we really enjoyed the work because we took a little bit of a different tact in terms of how we attacked the process. So before division and departmental leadership came together to talk about what we wanted to do for our measures, each division actually met separately. And division directors selected staff to participate in divisional process, and so that actually rolled up. So we took all of that work that each division had done when we sat down at our department leadership session and used that to inform ourselves regarding how we wanted to pursue performance Clackamas and what were some of the key measures. So one of the key measures for us, because behavioral health has been something that we've seen a significant increase in, is 90% of all of our residents seeking behavioral health services will receive a response within 1 business day of expressing that need. So FY16, 17, the actuals there were 65%, the target was 65%. So in FY18, it was 85%. I think that we've actually, Mary and her group, and also Deborah's coming in on the clinical side, have been doing an outstanding job of meeting this. This is a growing need, and will continue to grow. I'd like to be able to say that what we want in terms of projected performance would be 100% related to this particular measure, but the reality is we have neither the staffing nor the funding to meet that goal in terms of what it would take for us to meet 100% of the behavioral health need in the county in 1 day. We have an outstanding crisis response unit that actually, in terms of crisis response, is within 1 day of meeting that need. The percent of houseless individuals served by the continuum of care programs who move to or maintain stable housing, FY17 was 84%, the target was 87%, and then projected performance for FY18 at this point is 93%. So we've seen, a nice growth. One of the things that came out of our work with Performance Clackamas was the fact that the department realized it had to be more integrated in how it did its work. An example, the Housing Authority, we have there, Chuck, how many people do you think we have actually?
Housed?
Yeah.
Wow, I'm gonna say.
Could you use the microphone, please, Chuck?
Yeah, okay. So it's about 4,000 individuals that are housed across the Housing Authority. And, we've been looking at, what's the expression of community? What is the expression of sort of what it's like to live in Housing Authority complexes? Realizing that we got a number of people who feel isolated. And so part of our work is actually reaching out to our residents within the Housing Authority and beginning to build a sense of stronger community, to, looking at how those residents consume health care. So, and that actually transcribes and transfers across to some of our houses programs like the Continuum of Care, where in order to move that percentage and get that target up in terms of how we are meeting that need, the only way we can do that is an integrated effort across the entire department. So the percentage of volunteer connection program volunteers who feel their services meaningful, and this is what I referred to in terms of our other FTE that we're not actually paying to do work in the county and who help our department be successful. FY17 actuals were 91% with a target of 95%. Our projected performance for this year is going to be 90%, and then our target for FY19 will be 95. Interestingly enough, and these targets I think are going to be a little difficult going forward, is that we have actually seen a drop-off in volunteerism. And we don't know exactly why. We don't know what is causing that. So, our focus is going to be on marketing, letting folks know that, there are huge opportunities here in terms of volunteerism. And we do actually rely on volunteers for some of our services. And so that is something that Brent and I have been talking about in terms of what are we going to do about this. The opioid prescription per capita, FY17, it was not applicable because this was brand new. What we want to see for FY18 is a 1% drop. Projected performance is a 7.5% drop. The target for FY19 is 2%. So you see there, for opioids, these percentages are not what I'd like them to be. I'd like these to be significantly larger, but we are moving a fairly significant system across the county in terms of the use of opioids to relieve pain. We have seen an enormous issue with this across the county. We just co-hosted an opioid summit with the other 2 counties in the Tri-County area to talk about opioid use. And so there's ongoing work about that, and I'm certain we will probably have a little bit more conversation about that. The percent of routine licensed facility inspections within the 10 health equity zones that will be completed within the calendar year. FY17, this was brand new, so it was not applicable. The target for FY18 is 90, projected for performance is 95%, and the continued target will be 95%. So Dawn and her folks in doing the health inspections do a fantastic job. They've broken up the county into equity zones, 10 of them, that allows them to more specifically measure how services are being distributed across the county. And actually also allows us to take a look at where poverty is affecting services across those areas. And also this work, and we're not going to be talking about it necessarily here, but the Blueprint to Health for Clackamas County that Public Health has been leading has come out, and the 10 health equity zones have been a key piece of that work. Percent of energy assistant program client contacts made prior to utility disconnection. So this is a key measure in terms of if you can get folks in for services related to their utilities before disconnection, we save a lot of money because there's always a reconnection fee. And so this is a marketing, again, and letting folks know that this exists. We actually, Brenda and her group did an enormous push in terms of letting basically Spanish-speaking folks know that this service is available, and we've seen a significant expansion in terms of people seeking assistance related to utilities. And also, I think we've seen a significant expansion because of economic need. So there, the FY17 actual was 88%. Our performance for this year projected is 85, and we'll continue with this target at 85%. So let's see some stories out of this, from volunteerism. So last year, in the last fiscal year, we had 186 RSVP, and that was Retired Senior Volunteer Program, who provided, as I talked about workforce, 32,000 hours of volunteer service. And so it may be that maybe one of the causalities here in terms of the drop-off is that as our volunteer cohort ages, they're less able to provide that volunteer service. And we haven't done a specific study, so that's somewhat of a guess on my part. And we do know that people who are not retired have less time for volunteering. So so for those folks who when your time is freed up from the budget committee, if you're looking for other opportunities, we do have them.
You're cute.
Thank you. It's been a long time since I heard that. So one of the things we heard, and just another plug for volunteering, is we have a direct quote from one of the volunteers. The volunteer service I've done for others has not only helped me make me feel like a contributor, but it's also helped individuals who have had very limited trust in government feel like they're being supported. One of my clients has learned to believe that others are willing to help and are able to do so. From my initial contact with this individual, he was skeptical of getting any help. Now, after working with this individual for over a year, he has come to believe others can help, and it makes me feel good about what I do and why. So one of the things I just wanted to talk briefly about, and I mentioned this previously about the behavioral health unit. So we had a very recent situation in Malala where a man from Malala called in to our crisis line who was actively suicidal. Now, the issue with this was we had no idea where he was. He informed us that he had divested himself of all of his possessions. And crisis line staff kept him on the phone for over 4 hours. They were working with the behavioral health unit, which is part of crisis. They were working with law enforcement. And they were actually able to, with law enforcement's help, ping cell towers and get an idea of what his location was. They were able to sort of through that, talk him into getting back to his house. They were able to get crisis staff out there to meet with him, stabilize him, work on a safety plan, and this individual is now doing much better than they were before. And they were, this person had an active plan. They had developed, and basically had moved to the point where they were seriously considered taking their own life. And so this is, again, something that, County General Fund helps us do and expand. And we have been slowly expanding the behavioral health unit across the entire county. We have the majority of the law enforcement in this county actively utilizing behavioral health at this point. Our next step is going to figure out how to charge folks, for that to get some collaboration. So if there's anyone sitting from the city of Milwaukee here, you might be getting a bill going forward.
Can't imagine. Carry on.
Just saying.
She will have no questions at all today.
Yeah, that's right. Shut it down before it starts.
I think I have more now.
Yeah, right. No. Oh, no, I'm fine with questions. So the next slide. Okay. So on to emerging issues, and maybe this is where the bulk of our conversation will lie. So one of the things we know for sure as an emerging issue is that our population is aging. The number of those above 60 is projected to double in the next 25 years. One of the situations this creates is that the home, if people are own their own home, often as they get a little older, that home becomes more difficult for them to reside in. My mother was recently diagnosed with a significant illness, and they have a house that is all of a sudden really kind of useless for them. There's not a bedroom on the main floor, and so the stairs now become a major issue. And this will be something that for us we'll be facing as this time passes, where we're going to have a large population that is going to have great difficulty staying in their homes. And then, what's next? And we don't have a population that has deep pockets related to being able to pay for, residential care. Brenda and her staff do a fantastic job of helping folks age in place, but we do reach a point where, the capacity and limitations of the department, we can't do anything to help folks stay in their home. Housing. We're going to be seeing, as folks know, a significant issue related to affordable housing across all of our income levels in the county. Projections for the county in terms of units needed to meet the housing needs is probably somewhere around 17,000 separate units. We are quite short. I've heard projections that are actually larger than that. Supportive services to allow the vulnerable individuals and their families to maintain their housing are going to be increasingly needed, which means, what I mean by supportive services, if we're taking, as in Ryan's case, as I described as an example, there's a fairly significant amount of services that go to transition Ryan from living on the streets to living in, getting a roof over his head. And actually, it takes sometimes folks a little while to get used to that. I worked with individuals who went back outside and slept for a little while, for a couple days because they were unused to having a roof over their head, felt claustrophobic. I worked with one individual, finally, when I got him into housing, it took him 3 months to the point where he could actually sleep in his bed. So so if you're tying into that, behavioral health issues, addiction, mental health, in order to keep folks housed, it takes a fair amount of services, like with that family I described, where you had the mom and the 2 kids who were all, as we discovered, on the autism spectrum. It takes a fair amount of services to keep a roof over their head. And so our need for supportive services will be expanding. Public health. So public health has a lot of mandated services they supply. You know, you're looking at things like, and actually they do such a good job with this that often you don't really hear much about it. But we still get tuberculosis outbreaks. And so they do the disease investigation, they do the contact investigation, they'll do the direct observed therapy for the TB meds. Well, we're seeing expansion in TB in the county. We actually have a hotspot right now. And for these types of disease investigations, I think it was 3 years ago, we had a potential Hep A outbreak. They engaged in a mass immunization up in Sandy. There, the county paid for, we tapped into county contingency to actually pay for that because there is no public health contingency for these types of disease events. The United States is projected to actually see these things increase. We're seeing a reemergence of dengue fever on the East Coast. And these things will continue. And I'm not actually at this point advocating that the county create a separate fund of contingency for these types of disease events, but more about, I know that the county will increasingly probably be required to, as the Board of County Commissioners, convene as the local Board of Public Health and be looking at how to respond on these events, because the state, where we have these mandates, is also itself tapped. It only has so much money to spread across all 36 counties in the state. And so I think, Donna and her folk do a very nice job of advocating, getting grants and doing that, but they're doing work right now where they're doing a 3-year look back in terms of their budget. They're doing projections looking forward, and I'm meeting with them later next month to talk about how we might be able to fill those gaps and respond to that projected need. Behavioral health, here we're seeing, I'll start with the schools. We've been, the board's been meeting with superintendents across all 10 districts. One of the things we're hearing uniformly is an increasing need for behavioral health services in all the schools. We have, I don't know the total count of schools in the county. It's well over 100, and what we're hearing is essentially they would love to have 2 or 3 behavioral health workers in every single school across the county. We've also, unfortunately, have an increase in our suicide rate across the county, which has us deeply concerned. At this point, in terms of youth suicide, we doubled what we did last year, and we're not through the fiscal year yet. So, and we measure this on the calendar year, and we do not know. We've been tracking this nationally. What we know for Oregon, and we know nationally, is the suicide rate is climbing, and what we know for Oregon is Oregon as a state is higher than national trends, and then Clackamas is higher than the Oregon trends. And we don't know specifically what these drivers are, but we do know that we are experiencing this. We just had a very, very recent suicide of a 17-year-old in Wilsonville. And my staff are working overtime to try and respond to this, but we only have so much resource and capacity as it relates to that response. Right now, with the Sheriff's Office, we are working across 10 districts to do threat of harm assessment, which is essentially identification of behavioral health issues across the school population as early as possible. So many of the schools have school safety officers in the schools, and they work with school administration on identification of those kids. And so we're working right now. We have 2 positions working in the county across at least 9 districts, and then potentially including the last district to sign on in terms of a systemic threat of harm assessment across the county. But we still have an enormous amount of work to do. One of the areas that is a struggle in terms of suicide, particularly in youth, is that we don't actually, at this point, and we've got some laws that are in our way, it is very difficult. You know, it's easy if someone dies unexpectedly from a physical standpoint, that they do an autopsy to try and figure out what happened. There are a lot of blocks in front of us in terms of being able to do a psychiatric forensic analysis of why suicide occurred. And that's one of the things that we absolutely need to be able to do, and so we're working on that. I've got staff working on it. We're working with the ME, the medical examiner, on that in terms of what we can do to begin building a forensic process to look at suicide. I do have, I've got a bunch of stats sitting here in front of me. I won't go into them because they're actually depressing, but we do see an expanding number across the county. And then lastly, I think in terms of emerging issues for us is just simply the Red Soils campus construction. At least 3 of our buildings will be affected by that campus construction. So we're already we're working with the county's administration on potential relocation, and it's not necessarily a bad thing. I think sometimes our close proximity to the jail may be a little bit of a deterrent for folks wanting to come up here and receive services. And once they put the courthouse up here, it might actually be even a little bit of a stronger deterrent for folks. So, but that's just in terms of for us, and it will be an emerging issue. And that's maybe the shortest presentation I ever actually engaged in. So I'm open to questions now.
We'll start with Commissioner Humbertson.
You had suggested that it might be that
Your microphone.
volunteers. You suggested it might be the case that volunteers are aging out, so what kind of recruitment processes are you developing to recruit more volunteers?
Not my
Well, actually, you know what I'll do? I might have Brenda come on up and chat with us about that.
So the issue of volunteerism is actually a nationwide trend, sort of historically, and particularly in the volunteer programs that are operated under the county auspices. We really ask a lot of volunteers. As Rich said, they're almost like staff. They're scheduled for shifts. There's training requirements that are sometimes weeks long. There's ongoing interaction with vulnerable clients. So we really ask a lot of them. And as we're seeing sort of one cohort age out of the volunteer network, the cohort that's coming in may have a similar interest in volunteering, but not in the same way. There's something called a Done in a Day project, and you'll see sort of, workplaces coming together and giving their folks, an afternoon to all come out and, fix up a senior's home or work at the food bank. There's sort of episodic volunteer opportunities that are tend to be more appealing to the younger cohort of potential volunteers. So we are particularly challenged in social services around our transportation Reaching People program. For over 30 years, volunteers have driven older adults and people with disabilities to doctor's appointments, dialysis treatments, all kinds of really important things. And we're seeing those numbers really drop off. In terms of what we're doing about it, we are looking at the national research. We're looking at different ways where we may be able to modify our programs. We had a very successful volunteer fair in this building just a few weeks ago where we had, I think we had about 30 to 40 volunteer stations and hundreds of people coming through wanting to volunteer. So we're looking at ways to promote volunteerism, but in terms of the programs that we operate in the county who really rely on volunteers, we're going to have limited ability to shift those programs around. So it may look like a contraction of what we can do, maybe some streamlining, and maybe moving more into the raising awareness of the importance of volunteering and helping our partners in the community identifying those more episodic volunteer opportunities that may be more appealing to people who want to volunteer in the county.
Thank you. it sounds like it's still going to be difficult to get people to make those long-term commitments.
Absolutely. We really don't see anything changing in that respect. You know, for the drivers, as someone, we pay 41 cents a mile for our volunteer drivers. You know, if they're interested in that small little bit of financial support, you know, they could become a Lyft driver and make considerably more, and then maybe not be available to drive some of our clients around.
You said that you don't have a contingency for disease outbreaks.
We do not.
It seems to me that would be a discussion you ought to have with the county manager and look at that for the, not necessarily for this year, but look to develop something like that in the future.
Actually, Mr. Krupp and I have talked about it. And, you know, like we do with the Hep A, at that point, I think, I do not recall specifically if we convened the board as the Board of Local Public Health, but it was essentially kind of that process and dipping into contingency with that request. And it's actually, you know, I think a lot of other government entities do that where they don't necessarily set aside dollars because you never know. I mean, so, you know, you could go 5, 6, 7 years with nothing,
Yeah.
and then you get something. And so the question becomes, why lock up general county fund dollars? So if the county has enough of a contingency, and if it was a big enough event, then it becomes an emergency event. And then, you know, you're talking FEMA, you're talking, so we're not gonna necessarily do that in a solo way. But I think it's an important thing for us to talk about because it could be that what we're seeing in this TB hotspot is it may actually push us into, you know, potentially a contingency request. So that may be something you and I might be talking about next week.
There's been rumors that the federal government may cut the heating assistance program. Have you heard anything more about that, and are you prepared if that does occur?
You know, I haven't heard about that.
The farm bill, which
May cut
provides
it.
SNAP money, has not passed.
Yeah, that's two separate bills, but for the energy assistance, it's often on the cutting block. Community Action has really strong federal lobbyists working every day to ensure that we have those federal dollars. We're getting more and more assistance from the state now through the Oregon Energy Assistance Program. But yeah, any decrease in the federal assistance would reduce the number of low-income individuals that we could help with.
Would it completely wipe out the program, or you'd still be able to do some at least with the
Yeah,
state
so
funding?
right now it's about 1/3 federal, 2/3 state. Last fiscal year, we served about 5,000 households. So if the federal dollars were to go away, what's that, about 1.5 households potentially not served.
And the last one, just as a thought, a lot of the new housing that's being built seems to be two-story townhouse type style housing and that sort of thing. So thinking about keeping people in their homes in the future as they age up, possibly funding for lifts for stairs. They're not necessarily real expensive if you don't have
Right.
to get, you know, Cadillac type lift, but that may be a way to keep people in their homes.
Yeah, we do actually have a program through community development where people can apply, and we've built ramps for folks. We've made their house more age-friendly. So, you know, we do have actually funding for that. It's not deep. So as this expands, it may become an issue, but you're absolutely right in terms of those types of things that allow folks to stay in their house.
My wife and I had a two-story house back before we came here. I said, never again.
Yes, I completely agree with you. Yes.
That actually, because I had a basement, it was 3 stories. So the toolbox that I needed was down here with the tool that I had to go never again.
Should have 2 toolboxes.
I should have had 2 toolboxes, yes, it might have made it easier.
So looking through the budget items that we received, I just had a couple of questions on some of the metrics. But I think I already know the answer, so I just kind of want to test myself.
Okay.
And so I think that the answer to a couple of these is federal funding especially has been either curtailed or could be. And so funding is an issue, and also having sufficient staff to be able to carry out projects would maybe be part of the reason for the other issue. But I was wondering why on In the children, youth, and families, one of the results is the percentage of families that are healthy, stable, and attached. The target last year, or the year that we're just ending, was 80%. Looks like you're going to hit 96%, but your target for 18-19 is 85%. I guess I was kind of wondering why that wasn't like maybe 90%, if you're going to hit 96 this year. It's kind of gone up a little bit.
Page, please.
I'm sorry, thank you very much. It's on page 24, and then 25 is the budget page on that. 24 in our budget book. So I was just wondering why that was not a little bit higher, since you were going to hit 96% this year, and why it's at 85%, only a 5% increase from last year. Yeah, just press a button.
Basically, trying to be realistic about who we're working with. Most of our clients that we're working with, the difficulty is increasing. And so we're just trying to be realistic with what we really think we can hit.
Okay.
I have no problem with high targets, but, when we're working with domestic violence, I can't predict if somebody happens to be in Clackamas County when they do the event. So it's those type of things where we're just trying to be realistic and as scientific as we can with the measurement.
It's a great rate for this year that we're in, 96%. I congratulate you all on that.
Yeah, we
That's
did
pretty
we did
awesome.
good, but all it takes is one family, multiple events, and there's just statistics. So
Okay, thank you.
the goal is still there.
Yeah.
Our desire is still there.
My next question is on the Housing and Community Development Division. On the output is number of affordable units completed. In 16-17, the goal, or the actual, was 60. The target for this year was 100, but it looks like you think you're only going to hit 27. And the target for FY 18-19 is 150.
Page.
Thank you. I'm so sorry I forget to do that. Thank you for asking me that. 42 and 43.
Okay, I think. I know
And
the
so
answer.
what I'm curious about is, what are you going to do differently? How do you think something's going to be different in that? And then I notice accompanying that is the possibility of a reduction in funds from community development block grants and from the home program and probably a couple of other federal programs. So how do all those things fit together?
Yeah, so, and I'll let Chuck go into this detail, but one of the things you're seeing in the home and CDBG is actually federal intent, and they're reducing funds. Also, what you see here, and Chuck can talk about that, a little bit has to do with these numbers in terms of units completed depend on how projects are lining up. And also how community development looks at a project as completed. So if they complete a project in a particular fiscal year, those units are going to count. We're not necessarily going to then carry those units forward in our measurements. I mean, if you look at the use of home funds over the last 12 years, which I think is about $8 million or something, we have actually, out of that, leveraged well over 1,000 units.
Nice.
So it's over time. But in terms of Performance Clackamas, what you're seeing is just how those units get counted.
So in terms of the housing numbers, we projected, as Rich said, how many units we expected to be completed. We defined completed as somebody able to move into that unit. And in particular, this large number of 100 units included the Rosewood Terrace project by PEDCor. We experienced a 6-month delay in that project because of reviews by HUD, and as such, we got started late on that project. So what you're seeing in the projected performance for 17-18 are the units that we completed in Molalla, 27. And that the larger target for 18-19 is the Rosewood Terrace project, which is going to break ground here shortly.
Okay.
And then we anticipate of those 212 units, about 150 of them will be completed in the fiscal year.
Okay.
And in terms of the block grant and home, as Rich said, we tried to budget intent because we never really know what we're going to get. But it turned out we ended up with a little bit of a favor and got more money this year than we had anticipated. Will that be there next year? We can't tell. So it's a real roller coaster.
So it still sounds like the federal funding is a big issue. As long as we don't know exactly what's going to happen, we can't really count on anything. And then if you had the federal funding, you still need the staff
We
to
do.
help you carry out the functions of that.
Now, at community development, we've been lucky to be able to just maintain our staff at 9.5, so we've been pretty steady for a long time. A lot of that has to do with the fact that we manage the projects in-house. We don't pass that money through to other jurisdictions, so that allows us to kind of use those project funds to expand how much admin money we can spend. And we're about, I think at community development, we're probably about 85% federal funding, and it all comes through HUD. So, as HUD goes, so does community development.
Right, yeah. Okay, thank you very much. Just wanted to get that out there. Commissioner Bernard, and then Ms. Coldwell, and then Mr. Feely, Mr. Magdalene, and Commissioner Schrader.
I apologize that I was a little late, but we're adding a second floor to our home. And I had to help the guy with the tractor lift a beam up there. I got all bloody while I was there too, but,
Are you putting a lift in?
Yeah,
No.
you need a lift. You're aging,
Anyway, one thing I want to say is that what an outstanding job you guys are doing. I think
They are.
we have some of the best people working to resolve some of the toughest problems. And identifying where we invest our dollars, I think, is going to really make a difference in the future. Limited dollars. I thought I heard Ken ask about food and the SNAP program. That's why I said the Farm Bill has not passed, and that is where SNAP money comes from. So making sure that people have food to eat may be a challenge that we're going to have to take on again really soon. Housing first. I mean, I've been asked to go down and testify on the proposal that Metro's bringing forward, and I understand originally there was some concern about 45% of the money was to be spent at an income levels 0 to 30.
Mm-hmm.
And my understanding is that you guys added some flexibility to that, and you're more satisfied. Is that correct?
That's correct.
Okay, because I think if you look at our surveys, you'll see that homelessness is one of the top concerns on the list. It's impacting us all. And the other thing is that I had an opportunity to dedicate with Ken, I think it was just the two of us, the dental clinic. And I just want to say what a great job you're doing there, because, people have a tough time getting jobs, going to school, if they don't have teeth, or their teeth are in really bad shape. And really, when we talk about how to spend that, have we talked about that package deal yet? We haven't got there yet.
No,
When are we doing that?
next week.
Next week. Okay, so for that, I'll save the rest of my comments. But the wraparound services that you're providing are really key, but housing first, until we know what happens with that bond measure and what we know is going to happen in those relationships we have to build and partner to build more housing. It's important to have those wraparound services that you do. One more comment. I think your partnership with the Sheriff's Department has saved lives. And when I first got here, almost 10 years ago, we were closing our health clinics. We were kind of getting out of the business. And you've turned it all along with your staff, by the way, have turned it all the way around. And I look forward to actually expanding what we do in the future.
Well, very little credit actually goes to me. It's the staff here and people who were previous to me as director, so we appreciate that. Thank you.
Thank you. Ms. Caldwell?
Thank you. I actually have two questions that are sort of linked. One's small and one's large. One of the performance measures that you talked about was increased behavioral health in the school districts. So one of my questions was, is that because there's a change in population? Or is it because you are learning more about best practices for dealing with school-age children, and at what point do you intervene, that kind of question, which is sort of the larger question, is how responsive in your current level budget do you get to be when you learn new things about best practices and what's working in other jurisdictions? How flexible do you get to be within your current capacity to make changes to your programs based on what you're learning?
Right. You know, I think actually what we've done in the threat of harm assessment is probably a demonstration of that flexibility. It actually, a lot of times comes from our general fund. So, you know, each division has a little bit of general fund set aside because that's our absolute most flexible funding. And what we'll do at that point, so when we first started up the threat of harm assessment and we hired 2 individuals, it was actually a combination of H3S, juvenile, the sheriff's office, and actually community corrections, cobbling dollars together to fund these 2 positions. And we're kind of continuing to do that, in all honesty, but also then now talking to the school districts about how they can actually help with that cost as well. You've got a number of school safety officers coming from the different law enforcement agencies within the county that are placed in schools. And really what that's doing is, I think it's responding to 2 things. I think and I don't know what the causality of this is, but you do have an increase in mental health stress in kids coming into school. Whether that's coming from stressed families, and I mean, we have seen an increase in house assists and children in the county. That was our highest number in our point in time count. We have a lot of kids couch surfing. That's unbelievably stressful. I think we're also getting better at identifying this earlier. And that's what you're really trying to do, is identify those kids before they do something that everybody regrets.
Okay. So you're feeling within your current capacity that you've got the ability to respond to changes in what you're seeing across the country?
To a degree. And I believe also, though, that with current county administration, there's an absolute willingness to hear you know, unanticipated issues or threats. We can bring those forward, and you know, the county's been willing to respond with contingency. Okay. So it's actually, I think, a pretty good partnership. I mean, we don't have deep pockets. I know that in past conversations, people have, you know, looked at the success of the health centers, but those dollars are pretty much reserved for, you know, clinical operations, which is HRSA's expectation. Although they have actually done, you know, dental. I think I have Dr. Gonzalez sitting here behind me. I've received some fantastic photos of restorative dentistry they've been doing, and so they actually have allowed their dentists to pick up essentially a pro bono case and do restorative. I mean, they just worked on a vet a little while ago. We had that video on our site for a while. I don't know if it's still currently linked, where they actually did entire dental reconstruction. So went from having no teeth now to teeth. It's pretty cool. And so, but we don't have a ton of flexibility because, I mean, we could spend a lot of money in that area.
Well, and sometimes it doesn't even look like more money. It looks like placing your resources in different areas, depending on what you're seeing in terms of best practices.
Yeah. And in terms of the division's ability and willingness to work with each other, I think we're actually really, really flexible internally.
Okay.
People just sit down and have a conversation and move stuff around.
Thank you.
Mr. Feely?
Thank you, Madam Chair. I think my question may have been asked. Jim, were you asking about the policy proposal? The package?
Yeah, but I guess we'll
Okay,
talk
we'll do it
about it.
next week. Okay, that was my question. And my comment is, and it goes to volunteerism and other volunteer. I volunteer twice a week in a North Clackamas elementary
Thank you.
school. And I want to echo your concern about the behavioral health resources needed in the schools. It is desperately needed. There are so many kids with behavioral health issues. A lot of them undiagnosed, but it doesn't just lead to a horrific event someday. It leads to daily disruption of learning in the classroom for everyone. The teacher, the volunteers spend more time with those kids at the expense of other kids. So I've been doing it for 9 years, and I've seen that need just ramp up almost every year, and it's a plethora of issues, from homelessness to problems at home, to split families, to custodial arrangements. And I mean, I work with second, fourth, and fifth graders, and the second graders will tell me anything. I mean, they'll just blurt out in the middle of a reading group what's going on at home, and sometimes it's kind of shocking. And I follow up, and I try to talk to the counselor, but she's book solid. So anyway, I appreciate you bringing that up.
Mr. Magdalene?
Several questions, but one, I think you might want to update your performance Clackamas in our book, ensure safety, healthy, and secure communities, because it shows a decline for 17.
What page are you on?
Well, it's not numbered, unfortunately.
That must be part of the PowerPoint, not in our book.
It's
very-
the
at the
Performance
very
Clackamas
beginning,
Annual Report,
PowerPoint.
March of this year.
It's a PowerPoint. We don't have that in our,
Okay, sure, we'll make note of that, thank you.
it doesn't look familiar at all.
On the table.
I guess the real questions I have are, you talked about the red soils construction possibly and people not wanting to come here possibly as well. I understand the clinics, but I don't understand how you interface for behavioral health. Do they have to come here? Do you go to I can think of Gladstone and North Clackamas school districts have several community centers or family centers. How much actual face time, I guess is the best way to put it, are you interacting with the people that need the help?
Well, I guess 100% in terms of FaceTime. So we have clinical operation in Sandy. We have Sunnyside, as you mentioned, Gladstone, and then at Beaver Creek and Hilltop. So
You're out of this area.
yeah, so Hilltop, which is just over there. It has a huge amount of flow of clients going in and out of that, and also Stewart, which is more chronically mentally ill, more persistent and severe. So they see, they're fully booked day in, day out.
Can we get an example of what a typical day might be, or how many they might see?
I don't have the numbers off the top of my head, but Deborah, you want to take a shot at that one?
So I'd say at Hilltop, we probably have 25 to 30 clinicians working every day. And a lot of them are average, I would say, see 10 patients a day. Some see groups, which might have as many as 10 to 12 participants. So the behavioral health clinics do about, I want to say, 51,000 visits a year. And those would include those groups. So they see a lot of volume. We do have behavioral health clinicians that are embedded in our primary care clinics, which includes one at the Gladstone Children and Family Center. We also take referrals from the Gladstone High School that's across the street from the Gladstone Children and Family Center. The kids, we have an agreement with the school there, and kids are allowed to walk across the street to access behavioral health care there.
Thank you. Are there other examples of where you're out in the community as opposed to being here?
Clinics.
Yeah.
Well, the clinics is probably, in terms of behavioral health, where we would have examples also in terms of Mary's Division for Behavioral Health Services through the Community Mental Health Programs. So we've got contracts for services with a variety of providers across the county.
Now, do you have any comments on grant compliance and maybe how much you actually spend on time or dollars for the compliance part of whether it's HUD or something else?
Across the department?
Yeah.
Oh, wow. We've never done a study on that type of thing. I mean, we do spend a fair amount of staff time on complying with our grantors' requirements. I think for some of the work, it's so built into how we do our processes that we're doing the services and at the same time complying with the grant requirements. So I guess we've never really thought about pulling that apart to cost that.
Okay. Now, what's the biggest impediment to getting the job done? Other than money?
Federal funding and people.
Personnel.
Well, sometimes
money.
there's other regulations that may make it onerous.
Probably, in all honesty, that there across the day there's 12 hours of darkness, and is actually the biggest impediment. In all honesty.
Thank you.
You're welcome.
Commissioner Sadas and then Mr. Caton. Tom, are you back up again? Okay, thank you.
Two things, Rich. Earlier, Commissioner Bernard asked about the housing discussion that occurred last week, I guess Friday maybe. So what was that update with regards to the flexibility to the regional bond?
Oh, okay. So what Metro was originally looking at, and this is before they expanded the amount of the bond. They moved the bond in their recommendations from $500 million to $658 million. And part of what they were shooting for in their formula was of total units built, that 45% of those units would be 0 to 30 in terms of the income levels they'd be focusing on. Now, one of the things that it puts an enormous amount of pressure on the finance structure, the financing of those units. So, for example, and this gets complex fast, and so I'm trying hard to keep this from drifting into complexity. So what you're trying to do in terms of your financing structure is you're making sure that the units built, so like for our PEDCOR projects, it's 212 units. That's at 60% AMI. We're bringing in some vouchers to help with that. I believe 22 vouchers, 22 of the units will be vouchered. And so the math on that in terms of over time, that project paying and meeting its maintenance requirements, paying off its debt will work. We do not have anything besides the vouchers in there that's 0 to 30. So if we were to insert within that 45% of those units are now 0 to 30, that would be a difficult project for us to put together financially, because you're requiring a lot deeper in terms of subsidy. So what Metro did was they alleviated some of that by now, if the and this is a critical issue, if the constitutional amendment goes through in November, which is, I don't know the details of the amendment, but it's something having to do with the telegraph and changing up current language in the Constitution to reflect what is no longer used. It's been a long time since I sent anything by telegraph. So if that goes through, we'll see an expansion of units. If it doesn't go through, actually, it'll be a little easier for us because we're bringing in 200 vouchers to the conversation. We've already committed 200 vouchers. That helps with the 0 to 30 math. I mean, it's still a stretch. It's not been done anywhere else in the country. And there's no two ways around it. This is a very bold goal in terms of looking at how are we going to address the 0 to 30% housing needs, which are what we're seeing on the streets now. And how do you get folks housed who are moving into permanent houselessness? I mean, I think for the first time in a long time, this country is seeing permanent houselessness, going back to the 1920s and Hoovervilles. And, where people have now street families, and it's accepted, it's established, and that's folks' families. and like we have that example a little while earlier with Ryan. So I think that there's no two ways around it. The general obligation bond is currently structured is going to be a challenge, and it's going to take a whole lot of different folks coming to the table to make this work. The financing, the subsidies going to be required. I'm not too worried about for Clackamas. It'll be interesting to see, if the bond passes, what Multnomah and both Washington will do. I know that Washington is worried potentially about how this is going to work, but the way the math works, since they increased the bond amount, that if the constitutional amendment goes through, that percentage, as I calculated, slid more towards 40%. So there's a little bit of leeway here.
Yeah, well, I know that the board's been unanimous on our support of the concept
That's
of
been
the regional
appreciated.
bond, but the devil's in the details.
Yes, it would.
And one of my concerns is that they had a projection there that, we can do this for about $170,000 a door, which is really not practical. It's more like $270 a door, not $170 a door. So I didn't know when they drew up the ballot language if it actually included something like that, which would actually make it impossible. So I'm not sure where we are in the stage and in the language.
I don't know if they've put together the ballot language yet or not. I think that's still in the process of being written. Because I actually asked about that last time I went, and they were getting ready. Last time I attended the stakeholder meeting, and they were getting ready to start working on that ballot language. Because you're right, that's critical.
Yep. And then my second question, shifting gears to mental health and some of Mr. Feely's comments, as well as our discussions with some of the schools, and are the schools, the unions, teachers making a larger impact to our legislators when it comes to funding for mental health out of the state legislature? Because it seems that it's always been a weakness as far as getting enough adequate funding for mental health.
I don't know the answer to that. We have not teamed up with the teachers' unions to talk about, an approach regarding mental health. My guess is, at the union level, this has probably been expressed to the state, because I know, teachers who are concerned about this, and we've seen in other parts of the country where this has gone very, very wrong, and the sheriff worries about it. I worry about it, and we've gone as far as to actually have a response team in place. And the difficulty here is, tactically, if you get something that happens bad in a school, actually law enforcement's got that stuff drilled down, and it goes, they know how to do it. If you look at like the Umpqua shooting that occurred 2 or 3 years ago, that's still echoing across that community on the mental health side. That shooting is done. The tactical response is well over, and the mental health response is still going on. And so, I don't know about the conversations at Salem. I know that this is something that in the long session will be talked about.
It just seems that now, if more than ever, it ought to be something that ought to be more of a clarion call than ever, both at the federal and the state level, with all the school shootings and everything else that's taking place. That is a big component. It's really the mental health situation, more so than anything else.
Yeah, I don't know about, HRSA, SAMHSA, Centers for Medicaid. I don't know if this conversation, the Fed seems to get stuck in, it seems to revolve around the Second Amendment. And we don't seem to move into conversations about deeper funding for this.
Thanks.
Mr. Caton, and then Commissioner Fisher, and then Mr. Magdalene.
Yeah, thank you. I'd like to dovetail on that conversation around schools and mental health and the importance of that. And I know you've worked with the sheriff around the mental health training with the sheriffs. And I was wondering if there's a similar program that could be considered, mental health first aid or other kinds of programs out there for teachers that they can, looking at the preventative side before something happens, to help, the teachers and the school districts identify potential at-risk people to help get them. The other side of it, of course, is getting into services, but to help, with the school districts and understanding, what they look for and how to help with those folks that are in need in the schools.
What I'm
earlier
maybe ask Mary to come up and talk a little bit about this, so you can, listen to someone who's more articulate and better talking about this than I am. I mean, we spent a lot of time working on threat of harm assessment with this different school districts, and Mary's been doing, and her staff have been doing a fair amount of, deeper work in this.
So it's a great question, and it's actually truly prevention has to go in line with then also identifying risk factors. So we have launched both locally, and the state has really picked this up, mental health first aid. And there's a couple of different types of mental health first aid. So there's ones focused on individual adults. There's one focused on individuals working with youth, working with veterans, and also working with older adults, because the needs are different with that population. Frankly, the challenge is carving out enough time for teachers to be able to commit to a full day training. So we've been able to go in and do some short-term, like short 90-minute, what we call question, persuade, and refer, just to give some tools to teachers. So I think both the tools piece is really critical, and we alone have trained several thousand individuals here in Clackamas County in mental health first aid. We also train on ASSIST, which is actually a suicide prevention 2-day intensive training. Those are all free trainings to anybody working, residing here in the county or the other 2 counties. While at the same time, the student threat assessment program, which has really been a partnership with the juvenile department, the sheriff, and H3S. It truly is a true partnership. We launched that, we lifted that program up in March. And so far, we have screened at least one student from almost all the school districts that have signed up to be part of this. And the student threat assessment program, what's really important about that is that really does need to be in a lot of ways owned by the school district, because this is where our students are 6-7 hours a day, right? Mm-hmm. And what the program allows then is a multidisciplinary team. So we have folks from my crisis program, we have juvenile representation, we've got our law enforcement are present, our child welfare, developmental disabilities. So the expectation is when a student is identified and it needs to go to that multidisciplinary team, there's actually resources to offer. It's not good enough to say, oh, Johnny made a pretty viable threat. Good luck to you, school. Good luck to you, parents. So the expectation is if you're at that table, you're actually bringing resources. So for us at Behavioral Health, being part of the safety net, regardless of the insurance type, if there's a student who needs to be seen by a mental health clinician and potentially our psychiatric nurse practitioner, we can get them in that same day. And I have to tell you, the response from parents have been amazing. Mm-hmm. They have been thankful for the help. They didn't know it existed. So this idea that you're able to pull everybody together and have a pretty tough conversation, right, about these threats, and actually provide resources, at least in the short term. The long-term resources, that's still going to be the responsibility of how do you help engage that family to making sure that they have access to those resources. But short term, and again, we don't know what we're potentially preventing, but what we know is that this program in a very short period of time has been hugely successful, and we'll be able to share that data long-term with folks to really be able to advocate for really a top-of-the-line program here in Clackamas County.
That sounds good. I had a follow-up to that. It occurs to me that, when I was in high school, there was mentoring programs of older students with younger students. And if you could have, because of some HIPAA and other things that may be a factor, you could have 18-year-old senior high schoolers taking mental health first aid, for instance, for kids, and then be mentoring to middle schoolers and others in other programs, perhaps, in some capacity that would allow for additional preventative opportunities, I guess is what I'm thinking.
And I think your point is a good one. What we know and what we've heard from survivors who have attempted suicide is they would have talked to another peer if they felt like that peer knew how to get them help compared to an adult. So peers helping peers, youth helping youth is actually, you're absolutely right on.
Right. And when I see Michelle from NAMI, we were a part of that conversation back when I was involved with NAMI about how do you help with peers at that age, and that's a challenge. Absolutely. Thank you.
Commissioner Fisher?
Thank you, Barry.
Yeah, I was noticing on the results for the continuum of care for housing, there's a 93% success rate for individuals in the program. So I am just curious, how long is how great is the need? How many people are served? And if you could just give a little bit more information as to why we have such good success rate.
So-
I tagged her first.
We may not have the exact detail on that, and I think a piece of that has to do with the fact of how the continuum care works, and the
Yeah, so what I
go
can
into
say
that.
is that that data point is going to be talking about the programs that are operated by the county and by the other nonprofit organizations that apply for these continuum of care funds. So I believe that that data point is the number of households who remain in service. I don't have it off the top of my head.
It was how many successfully transitioned to housing
Yeah,
that were in the program.
that were in the program. So that means that, let's say they're in a
Northwest Family Housing, Northwest Housing.
Northwest Housing Alternatives.
Authority.
Yeah, yeah. So for example, let's say we'll have a program where someone can stay for 2 years. And so what that data point is saying that after, they've reached their time limit in the program, they don't move back into homelessness. They either get a Section 8 voucher, they've increased their income to the point where they can pay for their own, they're exiting to some sort of stable housing, they're not exiting back into homelessness.
So do we have any data on what the need is versus what services we're able to provide with the current resources?
So we have what we call the Coordinated Housing Access Line, and that's been in operation for about 2 years now. Oh, wow. Thanks, Chuck. The Coordinated Housing Access Line is wonderful for the individuals experiencing housing instability because they only have to call one number. It's great for policy folks because we have really good numbers now because people are calling one number instead of 10 numbers. So we have 1,258 households who have called the CHA line. They're eligible, but there's no place for them. So nearly 1,300 households, and multiply that by 2 or 3 to get the number of individuals who have called asking for assistance, and they're sitting on a wait list.
And if they were to get services, would they go into that continuum of care?
Potentially.
Is that the service?
Roughly. What we've done in Clackamas County, we're very collaborative. So this Coordinated Housing Access Line is mandated by the federal government as a best practice. It's only required for our continuum of care funded programs. But because we have these great collaborations, programs that aren't required to participate do. So in addition to the continuum of care programs, for example, the Bridges to Housing program that's funded by the county, those we pull names off of that the Coordinated Housing Access Line as well.
And do you know how many families we serve each year?
I think.
You know what? I would feel more comfortable maybe replying in writing, so we can
that's
get
totally
you because I
fine.
just don't have it off the top of my
I
head.
guess
and I
my
would love to give
question
you-
is, I was really happy to see, for some reason, through all of the presentation, I've missed the data point that we're 93% successful in that program. So I was celebrating that because that's a very high number for people that are in a program that transition from homelessness to housing. And so then my next question, and I am interested, but you don't have to say it now, is and it's higher level, but what do we know that works that gets us to 93%? What are the program elements, or what is the best practice? What are the
really good case management. So people who use best practice techniques like trauma-informed care, understanding that people come to us maybe have a lifetime of challenges, developing trust, developing those trusting relationships. So people will do what it takes. Because really, it's the person taking responsibility for their own issues. So it's the case management, it's access to things like substance abuse treatment, behavioral health, SNAP, food stamps, child care resources, transportation, all those things that most of us get to take for granted because they've already been there for us. But if you are low-income mom, working 2 jobs, a couple of kids, you're taking the bus everywhere, and you're expected to do X, Y, and Z, it can be really challenging. So really wrapping around services, providing each household the individualized support that they need, and helping build their personal resiliency so they can better survive the next sort of downturn that may come their way. And affordable housing. So we can do the best job for folks, and they exit the program and they're doing okay, but let's say their hours get cut at work. Or there's a snowstorm, so they miss a couple of days. Their office is closed. Are they going to be able to make the rent the next month? So building that internal people-based capacity and having enough affordable housing so people can maintain, for most people, well, in no place in America can someone afford a 2-bedroom apartment on a minimum wage job. You need 2 minimum wage jobs in order to afford, the most basic level of housing in our country, and Clackamas County is no different. So I would say those two pieces, affordable housing and the supportive services to help people overcome their past traumas, their current conditions, so they can be successful.
Yeah, that was really helpful. Thank you.
Mr. Magdalene?
Yeah, thank you. On back to the housing, the cost per door goes up. Is that in part because of system development charges? I don't, in our own, anything, no, very small?
That's not it.
It's a
The-
factor.
The
fact.
the SDCs are a factor. They're a very small factor in terms of the overall math. I'd say actually the system development charges are not the big impact in terms of the cost. The cost of the housing actually is the subsidy. So when I talked about 60% average median income, so what you're doing is essentially you're rating those rents. And you're buying them down. And so the way you buy them down is you buy the debt down in terms of build. And so you got to bring a ton of dollars in at the very front in order to be able to buy that cost to build down. And so that becomes the impact on the cost of the door. Does it actually cost that much to actually build it in terms of bringing the construction crews in, doing the construction? No. That's the total financing package, because the subsidy, you have to find a way to bring it down. Otherwise, you won't be able to afford the rents, and you're at market rent.
Right. I also will support several other members of the board talking about the impact of the various activities at school and the impact it's had, and anything that can be done to help. I see that more and more on that. Oh, and then one comment. Since I'm going through this performance Clackamas, and you've gone through it now, and it's very helpful. We see percentages as goals, and maybe it's possible to put some of the baseline numbers. How many people are you seeing serving
Sure, we can put that
in
in.
various, because I can't, it's a little more difficult to figure out exactly how many people you really touch in a positive way.
Okay. So we could certainly start adding those numbers in.
Thank you.
Commissioner Bernard?
I was going to say that one of our biggest failure is not communicating what we do. When I was mayor of Milwaukee, there was a homeless man. Linda Fisher connected me. He was a vet, got him in housing. Sadly, he got cancer and died. But I knew nothing about what the county provided. So outreach to city councils around the county and to the school districts. I wanted to mention that we're partnering. We had a meeting with the school districts, and we're really working together to find those solutions. We now have a housing committee.
Housing task force.
That housing task force, that they have a lot more information than we got today about the need. But communicating what we do at the county, this is why I've for years called it speed dating. We had to have a campus where we have a speed date and invite the school districts and everybody come through and meet. We did something similar.
We did.
On a small scale. I thought it was fantastic. Also, mental health first aid, which we offer here. we could offer at schools, and I think I heard mention we do that. But just communicating what we do, we do a really poor job of doing that, and that's probably the most important thing we do, because we have lots of help opportunities and ways to pay for it, especially if we can bill for it. And that's what I'd like to see happen.
Okay. I'll talk to Gary Schmidt about that.
Okay.
Commissioner Humberson?
I think Martha was next.
Was Martha next? Okay.
It doesn't.
Commissioner Schrader, you're on.
Yeah, my question, going back to the mental health issue, how closely do we work with Lines for Life? Because aren't they the 24/7
Yes,
crisis
and
line?
we actually have a contractual relationship with them, so yeah.
And
we work
aren't
with them.
they expanding their youth component? I met with the executive director not too long ago.
Yeah, I haven't talked
And
to
it
Dwight
se-
about
and
that.
it seems to me that they are looking very seriously because of the issues that they're facing in the school systems of actually increasing their capacity with youth peer-to-peer crisis counseling. So that might be something that we
Yeah,
look
I don't-
into with that.
You know, actually, Mary, do you know, did they take that contract on for the state?
Yes, I think they're picking up the youth through a formal relationship with the state, but I do want to highlight that we hold a contract. They do pick up our after-hours crisis line from, generally 9 a.m. to 7 or 9 p.m. to 7 a.m. And they also are who we just contracted with for our new senior loneliness line. So Lines for Life are bringing on the older adult volunteers. So it's older adults able to talk to older adults who may just be feeling sad or lonely or isolated. So they're a good partner for us for those specific kinds of populations that we want to reach out to.
And they also work with substance abuse and opioid issues.
They led
as
the,
well.
creation of the Tri-County Summit for Opioids.
Yeah.
So
I heard
Dwight's a
that
great partner.
was an excellent
It was excellent.
summit. Also, this question from a while back that I was thinking, when you mentioned these hot spots of diseases, you mentioned tuberculosis. Is it a drug-resistant strain? Is that part of the problem?
It
that
can
we're
be,
dealing with?
we're lucky that we don't get a lot of the drug-resistant variety because that is incredibly difficult to treat. I think the hotspot we're dealing with right now is, your regular variety of TB. It's just a matter of, tracking all the contacts down. And in this one, it seems like it might be a little bit spread out.
See who's been exposed to it. How closely do you work with vector control, if at all? Because they're usually the folks that are out there controlling mosquito populations, which
mosquito,
are actually vectors
Mosquito
of
rats. And,
equine encephalitis and encephalitis. Is that correct?
in West Nile and
West
yeah.
Nile, all that? Okay.
Probably not as close as we'd like. We were actually working. I know that Don was working on this relationship. They've had a change of leadership, I think. So I don't know where that actually stands at this point. Where's Don?
Yeah. Did you want to?
Sure.
It's actually written in state statute that our health officer, Dr. Present, sit on their board. So we have a nice bridge. Even in addition to the change in leadership, we do have some continuity of some representation on that board. So our infectious disease prevention and control division, Dr. Present serves as a liaison between that group and vector control. So it's there.
Thank you.
Welcome.
Thank you, Madam Chairman. The work that you and your folks do is very stressful and sometimes very emotionally demanding. When people are feeling that stress and strain, are resources available for them?
Yes. They can do the county's EA program, and we've also actually been working on looking at how do we, because there's a lot of talk about trauma-informed care, and one of the things we've actually been taking a look at is how do we turn that upside down and work with our staff regarding the trauma that's inflicted upon them relative to their work. And so we've had some ongoing conversations within the department about how are we going to do that. We've conducted some listening sessions in terms of talking to staff about Do they feel supported by their direct supervisor or manager in this type of thing? Some of the feedback we've been hearing is that, yeah, staff feel pretty supported, but there's still work for us to do. I think because we do have situations where staff are in some pretty difficult situations that are trauma causing, and we do give folks time to process that, take the time they need if they need it, and then. But I don't think we're probably there. We're not where I'd like us to be in terms of getting to the point where staff can really talk about the stresses of their work. If I look at simply what developmental disability does, they deal with clients who are total sweethearts, great to work with, and then they also deal with have a clientele that are incredibly difficult to work with and very stressful. And so, and their caseloads they're not 10, 15 folk a month. It's 60, and so it's difficult work, and so this has fallen into, for us, it's a capacity issue in terms of how much resource I can bring to it internally, because most of my resources are externally focused. So we've been slowly working on that. It's been led essentially by the director's office and a little bit of help. Mary's shop in behavioral health has been also helping.
Well, my last comment is that I know the needs are great and the resources are limited, but you and your people should be commended for the work that you do. I know it's very difficult and stressful, and that people hang in there for 40 years in some cases.
Nowhere else to go.
It is a remarkable testament to resiliency, I will say. So thank you very much for the work that you do.
For sure. Commissioner Savas.
Well, just to keep the discussion wide-ranging and getting back to Commissioner Schrader's bringing up vector, and I just wondered, after knocking on lots of doors, the thing that was a surprise that came up to me was a number of residents bringing up the issue of the increased amount of rats and a relationship to those who are growing their own chickens and so forth, urban farming, if you will. And I think I did not hear that TB is up. I didn't know if there was a relationship possibly between urban farming, putting feed out, attracts rats, so on and so forth, if there's any kind of relationship.
As a vector, tuberculosis, by and large, it can live in the soil, but by and large, it's all of us. It's human. The humans are the vector for TB. And certainly there are rat-borne diseases, and I have heard it said that, if you live next door to someone who's got chickens, you're going to have rats.
Jim.
What about cows and chickens?
Lots of rats.
There's lots of rats. I work with a rat.
So anyway, vector control is not our direct responsibility at this point. We do work with them. I think actually if you're looking at vectors, it's probably more your mosquito population as it gets warmer. And as it gets warmer and you have a mild winter, there's not a whole lot that trims down some of these populations. And that's why, you see the East Coast is getting a little warmer, a little wetter. You're seeing things that are returning, that didn't used to be there. I mean, DC used to be a swamp, and so it's actually now swampier.
Okay.
Mm-hmm.
Seeing no other questions, we thank you.
Okay, thank
and your
you.
staff
All right,
very
thank you.
much. Thank you for the
All right.
time you've given us today, and thank you for everything you do on an ongoing basis. I know I certainly benefit from it, and I appreciate it.
Yep.